Late Night Health continues. I'm Mark Alyn along with the insane Daryl Wayne. Be sure to join us at latenighthealth.com, and you can even visit us at facebook.com/Late Night Health Radio. We go to Florida right now, and we're going to spend some time with Joseph Pergolizzi, Dr. Joe Pergolizzi, and we'll call him Joe on our show here. We're going to talk about pain. Joe, welcome to Late Night Health.
Thank you very much, Mark, and hello to everybody in the audience.
Pain is something that just about everybody experiences, whether it's, a cut on their finger, which is minor, or chronic back pain, which is major. Is pain just part of life?
Unfortunately, pain is the number one reason why people seek medical care around the world. So you can say from a medical professional's life, everybody, all different medical professionals, are going to deal with pain. And that's interesting because you can have eye pain, so you see an ophthalmologist. You can have urological pain, you see a urologist, stomach pain, etc., etc. So, yes, it's unfortunate that pain is omnipresent.
You forgot to mention dental pain because a lot of doctors don't recognize dentists as doctors. I'm just saying. Yeah, I do too.
Indigenous friends, and yes, you're right. Dental pain actually is a third molar pain is a type of procedure that is used as a standardized type of testing element for pain.
Wow. Oh, I didn't know that. That's interesting. With the pandemic, have you noticed more and more people having pain issues?
Yes. When the body is infected with the virus, the immune system works to fight the infection. This fight could lead to you of feelings of muscle inflammation and weakness, which we call myositis, or joint and muscle pain, which we call myalgia.
And so the virus can actually cause pain? I mean, if you have a common cold, it's usually associated with, in addition to the sinus and coughing, you have body aches, maybe muscle aches. Is that the kind of thing you're talking about?
Sure, and that's a good question. And the answer is absolutely yes. Acute viral myositis, right, that's that muscle inflammation and weakness, is a rare condition that does occur during the recovery phase of an illness, more commonly seen with like influenza. And it's characterized by muscle pain and weakness with an isolated laboratory finding sometimes. And infectious or post-infective, what we call reactive myositis, can occur during and after some viral infections. Even after the virus is gone, the immune system may cause inflammation in some parts of the body for a few months. And symptoms are similar to what we call polymyositis. That means muscle pain and weakness throughout the whole body.
The opioid conundrum that we have. 10 years ago, people would come into a pain doctor and say, my back hurts, and they'd get some kind of opiate, Oxycontin, and get addicted to this stuff. And we still have an epidemic of opiate overuse, misuse. How do we get off of that?
I think we want to embrace a multimodal pain regimen. So what does that mean? That means both pharmacological and non-pharmacological remedies to address our pain. And we want to self-assess our pain. There are reasons sometimes why we may have pain, and really the severity of pain is what's going to, in a sense, direct you to the type of treatment that you need. Now, cancer pain is where drugs like that may be very appropriate, right?
Mm-hmm.
You know, and when you look at like the topic of opioids and cancer pain, I think people can see where that may have a role. But there are some unusual sources of pain that we need to be aware of that can affect everyday life, and that's stress and dehydration and not getting enough proper nutrition and the lack of sleep, just to mention a few.
I was talking with a friend the other day who is not in favor of recreational marijuana. I'm not a user myself, but if people can drink alcohol, which does reduce pain, at least at first, until that headache and hangover start, I personally have no problem with marijuana use. But for 30, 40, 50, 60, 70 years, because marijuana has been illegal until recently, many people with cancer use the opiates. They're zoned out of their head, but if they'd been allowed to smoke a joint or eat a brownie, it would have been different. Any thoughts on that?
You know, if you look at studies, across the studies for the use of medicinal cannabis for pain, you'll find that up to 30% or greater reduction in pain with cannabinoids versus placebo. And based on these studies, the authors of various reviews support the use of cannabinoids in a moderate fashion. And what we have to realize is that new research is always coming out. And the Journal of Health Affairs found a majority of people who use medical marijuana to treat pain do show favorable responses to it. But a lot of times it has to do with the actual product that you're able to get. And there may be differences between one product or another. And right now, it's not an FDA-approved type of product. So the best that we could say probably is that there's anecdotal evidence that medical cannabis in patients can be helpful. But there also evidence that suggests that this still has to be used and appropriately. The problem is we just don't have guidelines that tell us how exactly to do that yet.
Now then we can talk about doctors using off record uses for a variety of drugs. And of course, I am being a smarty pants here. Joe, we're going to take a break in a moment or two, and when we come back, I want to talk about topical pain relievers. There are CBD relievers now. Lidocaine is used. I want to know about the difference between the 4% that you can buy for about $10 versus needing to go to Dr. Joe and ask for a prescription for a 5%. Is there really that much difference? And now you're paying $50 or $60 for the same amount of pain coverage. And are there other topicals that we can use that are effective? Our guest is Dr. Joe Pergolizzi. He is. You're based in Naples, Florida, I believe.
Yes, I am.
And so isn't that a beach community?
That is. It's a more mature, meaning we're a little older community, and I mention that because pain in the elderly is also a big issue that we have to be aware of.
We're going to talk about that as Late Night Health continues. Pain in people over 50 as Late Night Health moves forward. Late Night Health is proud of our partnership with the EBC, the Evolutionary Business Council. Check them out at ebcouncil.com.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.
Recently, I met Jacqueline from Bright here in Los Angeles. She gave me a hearing exam and then showed me how to hear again with the new Signia Pure Series hearing aids, and she can give you your life back too. I hear birds chirping, birds cooing, and even my wife. They easily connect to my smartphone. The Signia hearing aids are amazing, and with the charge and go, I don't have to fiddle with batteries and hear all day long. Not hearing is frustrating for you and your family. I know you don't have a problem, but trust me, call Bright Here now for a free hearing exam, a $125 value, yours free, just for making an appointment now. There are offices throughout the Los Angeles area. Call Bright Here now at 323-424-7100. That's 323-424-7100 for a free hearing exam. There's no obligation. Call now, 323-424-7100, or visit them on the web at brighthere.com.
Welcome to Guide to the Soul. This is Robert Clancy. Hope is one of those words that has no synonyms. It just simply is, and it's something that you'll have in your life as long as you want it. You can only lose hope when you choose to let go of it. So why let go? Each day of your life is a blank canvas, and you will always have a choice on how you paint it. It takes courage to take a journey of hope, but it's up to you to take that first step. And it's always accomplished by taking one step at a time. Hope is the greatest beacon you have to help you find your way out of the shadows of darkness, back to the light of a new day.
For more inspiration from Robert Clancy, visit guidetothesoul.com or go to the Moments with Robert page on Late There's a lot of talk all over the internet about the remarkable benefits of Carbon-60, and baby boomers are especially excited about it. Greska's Carbon-60 is the premium Carbon-60, developed by an aerospace and NASA scientist. 95% of Greska's customers report positive results from this Nobel Prize-winning technology in just 4 days. Imagine more energy, better health, and more vitality. It's very bioavailable to quickly mend toxin-crippled cells. This is a super powerful antioxidant. Bob Greska is so confident that you'll love his Carbon-60, he wants to send you a bottle at 50% off the regular price to see how life-changing this will be for you. Call 720-600-6040. That's 720-600-6040. Visit c-60.com to learn more. Call 720-600-6040 now or visit c-60.com.
Sometimes it's not what you say, it's how you say it. Words are a critical aspect of success. How you get your point across is a crucial part of what makes anything sell. So do it right and hire a writer. Whether it's articles, blog posts, technical writings, website content, product descriptions, or ghostwriting anything from a novel to a nonfiction book about your navel, contact Servet Hassan. If you want it to sell, write it right. Email Servet at servet@servethassan.com.
Late Night Health continues. I'm Mark Alyn. Our guest is Dr. Joseph Pergolizzi, and he's based in Naples, Florida. We want to talk about some topical solutions for pain. We've mentioned opiates. We've mentioned morphine. We've even mentioned cannabinoids, which is, CBD and THC. Let's talk about some topicals. Do topicals work as well as ingestibles, doctor?
That's a really good question, Mark. And, when we look at that, the answer is yes for certain types of pain. Absolutely yes when we look at joints close to the skin surface, such as the knees and elbows, because it can absorb the topical pain relievers relatively quickly. And they can show positive effects faster than the oral relievers. Also, you can use another dose much more quickly than you can take a second dose of most oral medications.
Interesting. Is lidocaine, which is, usually a roll-on, they sometimes mix it with menthol, is lidocaine also the same drug they use for, heart attacks and in ERs, or is that just something I think I've seen on TV?
You're absolutely correct, and this is a common question that I'll get, Mark. Lidocaine is the actual medicinal product, and it can be delivered in a patch. You may know of lidocaine patches.
Yes.
It may be delivered as an injection. So it is the same molecule, only delivered a different way, and when you deliver it different ways, you have different results. So when you talk about injecting it, sometimes we do that before a patient has surgery. We'll inject a little bit so that there's no burning when you inject the following medication. A lidocaine patch is commonly used for low back pain and also for conditions like post-herpetic neuralgia, which is a result of reactivated chickenpox. That happens when you're immune compromised. You reactivate this chickenpox vaccine. It causes shingles, which is very painful, and lots of blisters.
Absolutely.
And then some people may wind up getting a chronic condition called post-herpetic neuralgia. So we use a lidocaine patch for that type of pain medicine.
During our break, I mentioned that I asked you, is there a difference between the 4%, which is cheap, in a patch or in a roll-on, versus a much more expensive prescription strength of 5%? And you gave me the answer. Thank you.
I think what you're sort of highlighting is the concept of compound pharmacies, where a pharmacy is making a specific product at a specific strength or combination of products that aren't commonly available over the counter or not mass-produced through a prescription drug type of processing or manufacturing. And compounded products usually are going to cost more money. Unfortunately, I cannot draw on a clinical study that looks between 4% and 5% and tell you which is better. I did publish a clinical trial taking 1.25% menthol and adding a natural product to it, and that combination did better, faster pain relief and better pain relief over time than menthol alone. So sometimes we'll combine products, natural products, in a cream that will allow us to achieve better outcomes.
That's interesting, because we talk about a lot of natural products here at Late Night Health, and we prefer them. Are there side effects from lidocaine, from a roll-on or a patch?
Sure. A couple of the things that I can bring to mind, let's say related to a patch, might be related to the adhesive. And sometimes people will have problems with adhesives. These types of patients usually have problems when they have any type of sticky Band-Aid or something like that on their skin. Mm-hmm. You may also get a very rare condition called methylhemoglobinemia, and that is an effect on your body's ability to carry oxygen. So, like any drug, there's what we call an on-target effect, meaning what we want, and in this case it's pain relief, and an off-target effect, which is side effects. And these happen with any drug.
We mentioned, again, seniors. As we get older, You're still very young, and one day you will hit 40, I promise. That those of us over 40, maybe even over 50, we have our bodies are wearing out. I mean, knee replacements, hip replacements, shoulder replacements, brain replacements. All of this is due to pain. Seniors require a different approach to pain management than, say, younger people?
Yes, you bring up a great point, Mark. As we get older, around that ripe age of 40, we see what we call physiological decline throughout all of our organ systems, our liver, our kidneys, our brain, our heart. But that shouldn't scare people because now we're living into the hundreds. But it does change the way the drugs are broken down in our body, the way we metabolize these drugs. And think about it, as we get older, it's not uncommon to have a couple different medical problems. So you may be being managed by some natural products and some prescription products combined with your pain medicine. And that could result in what we call drug-to-drug interactions, both in the way they're broken up and removed from the body and in the type of reactions that you may see from the side effect profile.
Right.
So it's very important to have your healthcare provider know what you're taking and why.
Is there a product, you mentioned that you did a study on menthol and some other natural ingredients. Quickly, is there a product that's been produced?
Yes, there is. The product is called Instaflex, and this is a combination of a low-dose menthol with an oxygenated oil that produces an unexpected effect of improved pain relief and faster pain relief. And this has been proven in clinical studies. And what's important to realize here is, as I've mentioned before, that it's not uncommon that we combine products. Now, the rules of combining a product are that we want to use the lowest effective dose of each product in combination to get to the strength of a product at a higher dose by itself. And sometimes we will get unexpected results that surprise us, particularly when we combine natural products with over-the-counter or prescription products.
And the name of the product again that you're recommending?
It's called Instaflex Topical, INSTAFLEX, and that's a cream, a topical cream. It comes in a roll-on, a spray, and can be found at HepaDirections.com.
Gotcha. Hey, listen, we really appreciate your spending some time with us. We look forward to doing this again and talking more about pain, because as we gray here in America, as we age, we need more information about pain management. And I'd like to turn to you and have you help us disseminate some information, especially from a natural point of view. We're out of time. We've got to wrap up our show. Dr. Joe Pergolizzi has been our guest. Daryl, thank you for everything you do. We appreciate it.
My pleasure.
And we will be back next week at the same time, same station. Ooh, I've never said that. Always wanted to. I'm Mark Alyn. Have a good week, everybody. Have a great week. Most importantly, have a healthy week. We'll see you next time. Bye-bye for now.